Hi, I'm Anthony Ghosh, a spinal neurosurgeon and founder of the Spine MDT. Have you had any difficulty with your gait or unsteadiness in your walking? Well, in this video, I'm going to explain how that can be caused by problems in the spine. So if you find that when you're walking, you're just feeling a little bit unsteady on your feet, you're losing confidence, you're holding onto banisters or railings, or even you feel like your legs are just getting weaker, often it's the signals from the brain making their way down the spinal cord to the legs along the nerves are just not getting there effectively enough. And likewise, the signals from the legs, from the different joints in our bodies, getting to the brain and telling the brain the position of the legs is also not getting there effectively, and that's what's causing this. So to explain this, let's run through the anatomy of the spine very quickly. So here we have a whole spine of the human body. It's divided into the cervical region, which is the neck area, the thoracic region, the bit that's enclosed by your rib cage, and then the lumbar region, which is your lower back. And then deep in the pelvis, you have the sacral region and the tailbone, the coccyx. The spine is made up of a stack of bones called vertebrae, and each vertebrae is a block of bone. I've got a normal human-sized stack here with an arch of bone attached to the back. So if you put these bones together with the arches stacked on top of each other, you form a tunnel in the middle through which runs the spinal cord, and that's the main chunk of tissue that sends messages between the brain and the body. The spinal cord runs through the neck and thoracic area of the spine and just the upper bit of the lower back, the lumbar region, and it terminates at that level. And then beyond that, it's just the nerves that run down. So, if anything compressing the spinal cord is happening, then that would slow messages between the brain and the body. Likewise, in the lower lumbar region, anything compressing the nerves can do the same and generate weakness, but clinically we can tell a difference between those two things. So let's start off with the lumbar spine, this lower region of the back, where you don't really have spinal cord, but you've got the nerves running through that central spinal canal, that tunnel in the middle of the spine. With wear and tear, thickening of ligaments, joints, bony overgrowths, that tunnel can get narrow in focal areas, pinching the nerves running down. When that happens, prior to weakness developing, patients normally complain of pain or numbness in the legs, particularly if they stand for a period of time or walk any distance. So as they're walking, the pain builds up, they stop and rest or lean forwards even, and then the pain alleviates. And it's only in a sort of later stage that they start to experience possibly some unsteadiness of their walking. Maybe your feet are just a little bit wider apart when you walk. And there's a phenomenon called abasia and astasia. So sometimes looking up, if you're looking up to hang clothes on a washing line, change a light bulb, get something out of a cupboard, you suddenly feel unsteady on your feet. So usually when that's the case, when you've got some lower back pain, pain in the legs, and unsteadiness of your gait, that's when I worry about the problem coming from the lumbar spine and maybe some stenosis in that region. But now let's have a look at the spinal cord. This is the structure that lies inside the spinal canal in the neck area of the spine and the thoracic area of the spine. And it sends messages directly from the brain up here all the way down the spinal cord. It transmits those messages, those signals. So this is the front of the neck, the back of the neck. If anything is blocking the flow of those messages here, such as a disc pinching the spinal cord, up here in the neck or lower down in the thoracic spine, that can also give you an unsteady gait. And in that context, you don't tend to get pain going down the legs. You can sometimes get pain in the region of where the disc is, such as here in the cervical spine in this case, sometimes in the thoracic spine when you get disc bulges. But I will say disc bulges are very rare in the thoracic spine. That part of the spine doesn't have the same amount of mobility as the neck or the lumbar area, and therefore it doesn't wear as quickly. Now, if the compression is coming from the neck area of the spine, you may also notice symptoms going down the arm, like pain going down the arm, sometimes weakness or numbness of the fingertips developing. And that's because the nerves that leave the spine that innervate the arm and tell it what to do come from the neck region of the spine. These yellow things here are the nerves that go out to the shoulder and the arm and hand region. Now, problems in the thoracic spine, this area of the spine that's kind of deep within the rib cage, the thoracic region of your body. Anything affecting the spinal cord there will generally just cause problems in your legs only, so difficulty walking, weakness in the legs, and often it's not really associated with any pain in the legs, but you might have pain in that mid-back region. And then other problems that can cause compression of the spinal cords are things like tumours. So we have an MRI scan of the sort of cervical thoracic spine here. You can see the dark spinal cord here, and there's a mass here arising from the lining of the spine called a meningioma. I've got a video link below to tumours of the spine, and here's a cross section of the spine here, and you can see this taking up most of the cross-sectional area of the spinal canal, and the spinal cord being pushed over to one side. And this patient had progressively weaker legs, difficulty walking, and a little bit of pain just in the lower neck, upper back region. But the main complaint was actually just the weakness without a lot of pain. But also within the spinal cord itself, you can get other medical problems. Certain inflammatory lesions in the spinal cord can slow the signals down, and we see that sometimes, for example, in multiple sclerosis. There's a condition called transverse myelitis, which is an infection and inflammation that can happen inside the spinal cord. And then there are certain problems with blood vessels called fistulas, for example, where an artery and a vein has an abnormal connection, stealing blood from the spinal cord. That can cause swelling or lack of blood supply to the spinal cord. That can cause weakness in the legs. And other causes that are usually associated with a traumatic event are fractures of the spine. So we can see here on this CT scan, this patient has two bones that are fractured, one of them quite badly crushed, with this piece lying inside the spinal canal. And for this, they underwent surgery to fix the segment, stabilize it, and decompress the spinal cord. So good clinical examination and then usually an MRI scan is what helps diagnose this. If the problem is coming from the neck area, such as a slipped disc pinching the spinal cord, then the purpose of surgery is to try and preserve your current function and try and restore what we can. So the surgery that is required in this case, for example, is removing the disc and fusing the segment to free up the spinal cord. Sometimes this is carried out from the back if the compression is caused by some of the structures at the back of the spine, such as a tumour mentioned earlier. If it's in the lower lumbar spine, such as stenosis, which we mentioned earlier in the video, then the surgery that I've discussed this in a separate video on lumbar canal stenosis or spinal stenosis that I tend to perform is a minimally invasive decompression, where you have this very sort of narrow approach with a small incision in the back. And through these sort of retracting tubes and a microscope, you just remove all the thickened tissue in the spinal canal to free up the nerves around the spinal canal. I hope you found this video helpful. If you did, please click like and subscribe to the channel, and please visit us at spinemdt.com for further information about our 3-step process. You can also take our free spinal assessment tool here. Please visit us and we'll be very happy to help you. Thank you.